We're now going to look at scapular squeezes and rows. These are going to be exercises that work the scapular retractors. And some big ones are over here, the superficial middle trapezius muscle. And then deep to that would be rhomboids minor on top and then major on bottom. So middle traps and rhomboids. Now, the first thing you should probably teach the patient is how to perform a scapular squeeze. All a scapular squeeze is it's just retracting the shoulder blades, bringing the shoulder blades together. So with that, they can be either sitting or standing, and you're going to have them draw the scapulas together and hold. I usually recommend holding anywhere between 5 to 10 seconds. 5 is probably where you want to start out and then build up from there. If you have to, you can even start out lower than that, even 2 to 3 seconds. But when you're first teaching these scapular squeezes, you want to start building up that rhomboid and middle trap endurance a little bit, so then you can strengthen it later on. Once you've held for the allotted time, you can relax them back to the start position. But it's really important for rows that we're about to see here to know how to retract the shoulder blades. Now, a word on rows. Rows in the gym are very different than rows in the clinic. In the gym, oftentimes you're trying to build muscle, right? And so you can afford to use a lot more arms there because you're going to utilize the elbow flexors, the biceps brachii. You're of course going to use the middle traps and the rhomboids. You'll probably hit some more of the lats there as well. Not as much as rhomboids, but you'll get some lats in the gym. But in the clinic, we want to emphasize the scapular squeeze part of this much more. This is more of a squeeze the scapulas together than it is using the arms. You'll notice when I'm doing this with the Theraband, I'm not getting a huge amount of arm motion. Most of this is in the scapulas, okay? So the technique here, you're holding the ends of the Theraband, and while rowing your arms back, with the elbows in close proximity to the torso, you're drawing the scapulas together. Emphasize the scapular retraction here. And one other thing to prevent the patient from doing, if they're bringing the scapulas up, so using a lot of upper traps here, you want to cue them to not do that. You want to use as much scapular retraction as possible, but minimize upper trap activation. Okay? And then once you do the repetition, you relax to the start position. Now, obviously, you're going to start out with lightweight here. And this is one where you can afford a lot of repetitions, 15 to 30 even. Usually, I will prescribe 20 repetitions of this to really build up the endurance of these scapular muscles. If you're eventually going to progress to heavier weight, obviously, you'll lower the repetitions to around 5 to 15. Here's another view of the same thing. It's less of arm movement, much more scapular retraction. And emphasizing that scapular retraction is important for a lot of conditions like postural problems, so upper cross syndrome where the retractors might actually be a little bit weak. Or in thoracic outlet syndrome, really activating those scapular retractors helps to clear space for components of the brachial plexus to get out to the upper extremity so they're not being compressed on their journey out. Okay?